often suffer from heavy and irregular periods. During reproductive life, women are supposed to have a period once every month, and normally the period lasts for 3 to 5 days. Now, what do we call excessive bleeding? Obviously, there is no measure. Women, they actually compare with their own periods. So someone who was having very scanty period, even a normal period may look excessive. On the other hand, if the period was excessive before, a normal period may be considered as scanty. So there should be some yardstick which will tell us what is heavy period. If the period lasts for more than 5 days, if the period is so heavy, the woman has to change at least 6 times every day. If she is staining her dress and bedclothes, if she is so tired that she cannot do her usual household activities and go to work, and finally, if we check her hemoglobin and she is suffering from anemia, that means her hemoglobin is less than 10 without any other cause whatsoever which can explain this fall in hemoglobin, then even if that woman says she is having normal period, then that period has to be heavy. Now, once we have confirmed that her periods are heavy, we need to identify why she is having heavy periods. The commonest cause is hormonal imbalance. That can happen very commonly in early teens, when women they start, young girls when they start having their periods, and also heavy period is common in the middle age, and finally just before the menopause, when the period finally ceases, the periods can be quite heavy at that time. Often we find some structural problem in the uterus. If there is a small tumor in the uterus called uterine fibroid, if there is some infection, if there is some ovarian cyst, these all problems can result in heavy periods. Now, ultrasonography helps us a lot to identify whether there is any structural problem. Obviously, if we find everything is okay, we need to check the hormone levels and treat that particular woman. Majority of women would prefer medication or medical treatment rather than any sort of surgery. That's obvious, isn't it? Now, we can treat this woman with hormonal pills, with hormonal tablets. Pill not necessarily mean contraceptive pill. Any form of tablet is also called as pill. So we can give estrogen progesterone combination, or we can give just progesterone. These are the two hormones women they normally have in their system for reproductive function. But most interestingly, we can also treat this woman with the help of non-hormonal. The hormone is such a term, often people are scared to have hormone. As soon as you tell someone, I'm going to treat you with some hormone, they say, no, please, can I have some non-hormonal? We do have non-hormonal treatment, and one is called tranexamic acid and one is called mefenamic acid. These tablets can be given for 3 to 5 days during menstruation, and they work very well. They can also take away some of the pain that is associated with menstruation. If the medical therapy is not working, or the individual is fed up taking tablets for more than 6 months and 12 months, then we need to do some local therapy. Now, in good old days, if the medical therapy was not working, we used to do surgery. But nowadays, we very rarely do surgery for heavy bleeding. What we do, we can insert a hormone device inside the uterus. This is called intrauterine system. Now, what is intrauterine system? It's a small device made of silastic, which is non-reactive to the body, and that device contains progesterone hormone. And if we insert one such device, it stays in our system for 5 to 7 years and releases hormone locally, and thereby there is no excessive bleeding. And finally, we can do some hysteroscopic surgery, that is looking inside the uterus with the help of a telescope. If there is a small polyp, small tumor, we can remove those. We can remove excessive uterine lining, very thick uterine lining, and these procedures are called transcervical resection of fibroid, transcervical resection of endometrium. So instead of removing the uterus as a whole, we just remove the problem area of the uterus. And at the end, if the problem is so bad and the person is fed up with all this other treatment, then in a small percentage of cases, like only 5 out of 100, we do the operation called hysterectomy. Hysterectomy is removal of the uterus, removal of the womb, and we may or may not remove the ovaries at the same time. If it's a relatively younger woman, less than 40, we try to preserve the ovaries. If the woman is over the age of 40, then menopause is approaching, so we may have to remove the ovaries at the same time. So that is what we normally discuss with any woman who would come to our clinic with heavy menstrual bleeding, and believe me, it's a very common problem. 1 in every 3rd woman would come to our clinic with heavy bleeding. Another 1/3 will come with pain, and the final 1/3 will have the problem of infertility or difficulty in having a child. So heavy menstrual bleeding is a very common problem, and we can treat it in a very simple, realistic way without removal of the uterus in majority. I hope this information helps you. If you need any further, you can obviously come and see one of the gynecologist specialists in your area.